Hi folks, Dr. Ed Beyer. Today we're going over reason number 7, why your child is suffering from ADD, ADHD. If you've been watching my prior videos, we covered some of this on my prior videos. First thing you need to realize is that ADD and ADHD is a neurological problem. The area in the child's brain or in the adult, we see a lot of this in adults too, folks, that has to do with focus and the ability to control your impulses and socialize and all the symptoms we see with ADD and ADHD. That area of the brain has not fully developed. Does it mean that it can develop? Absolutely. There's a lot of areas of our brain that aren't fully developed when we're born. Like my area of my brain that knew how to ride a bike wasn't fully developed when I was born, okay? But I developed that when I became like 5 or 6 years old. So in our program, we find out which areas of the brain have not been fully developed. We do that through a comprehensive neurological exam, and then we give the brain, the neurons, those weak neurons, those underdeveloped neurons, exactly what they need. Once you do this, it works. 5 things that healthy neurons or underdeveloped neurons need. They need lots of fuel. Your neurons require more energy than any other cell in your body by far. I always say neurons are car engines that get 2 blocks to the gallon. And the fuel source is glucose and oxygen. Many of our kids have bad blood sugar issues, or they have hidden anemias. This occurs in the mitochondria of the cells, and the mitochondria make energy out of our glucose and oxygen, and we need certain B vitamins and enzymes for that to work. Number 2, healthy brain needs no inflammation. If the brain is inflamed, it's not going to develop properly. And so most of our inflammation as children anyhow comes from foods that we eat, and also dysbiosis in the gut, which usually is a result of being on antibiotics and things like that. Number 3, proper hormones, especially thyroid hormone. Thyroid hormone, and as we age, estrogen, progesterone, and testosterone. Number 4, we see this a lot in the kids, proper neurotransmitters. The area of the brain that deals with attention and focus and controlling your impulses utilize certain neurotransmitters, and those 2 main ones are serotonin and dopamine. And so we look for this. If you have a serotonin or dopamine deficiency, usually due to poor absorption or B vitamin issues, we check for that. The 5th thing that an underdeveloped area of the brain needs, it needs to be stimulated. It's like a muscle. If a muscle's weak, you make it strong through exercise. That's what we do with our program. And what makes our program different is we're not just exercising the whole brain, we're exercising the specific areas that need it. So folks, I hope that helps. If you know someone that's suffering from ADD, ADHD, I hope this gave you some good information. I'm Dr. Beyer. Talk to you soon.